Hi, my name is Kafui Vodounou. I am in group 8 and I'm making a video to for reflection, to share my opinion, what I've learned, and also the importance of considering ethical perspective in policy making. So what I've learned during this course is that in Africa, the integration of genetics and genomics technologies into healthcare, it has a potential to revolutionize the disease prevention, diagnosis, and treatment. But what we realize is that without the right policy framework, the economic disparities in access to these technologies could deepen. So policy advocacy plays a crucial role. It is true, because when we advocate for policy, we ensure that in this context, equitable access to genomic innovations around the country. So governments must adopt policies that incentivize private sector involvement while maintaining public health priorities. So effective policies could include tax incentives, grants, and public-private partnership that encourage private companies to invest in affordable, accessible genomics technologies. This kind of advocacy, it will ensure that the benefit of genomic advancement are not limited to wealthier urban areas, wealthier cities, to a certain class, but they are extended to underserved rural population, fostering inclusive growth in the healthcare sector. So I took I use Côte d'Ivoire as a takeaway message, because I live in Côte d'Ivoire, and policy advocacy here, when it comes to genetics and genomics, is essential to, as it brings a gap between the advancement in genomic technologies and underserved population by creating policy frameworks that incentivize private sector investment, such as favorable tax policies and regulatory support for biotech companies. The government can also stimulate innovation and development of cost-effective genomic solutions. But public funding initiatives must accompany these efforts. I mean, they have to try. They have to propose something to ensure that the technologies are accessible across urban and rural area, that is not just in one specific area within the country, that at the same time addressing the disparities in healthcare access. Policy advocacy, what I've learned really, and I believe, should focus on fostering public-private collaboration to ensure that private sector innovation aligns with the nation's healthcare goals, the Ministry of Health goals, particularly in addressing diseases that disproportionately affect African populations, such as, we know about malaria, parasitic disease, and so on. So the case study that I'm taking here is about the I'm using Ito Foundation. It's an organization that is they are trying to find. They're focusing on how policy advocacy can play a key role in integrating genomic technologies into national healthcare system, meaning coordinating and engaging into partnership with the Ministry of Health in order to enable the population to have access to the genomic technologies. So the foundation has worked on the ground to raise awareness, educate healthcare professionals, propose trainings and workshops, and promote the accessibility of genetic testings and personal medicine. Personal medicine, bringing an emphasis on what is right for you, what is right for the population, so they don't spend too much money into what they should not be getting. which is also cost effective. So this is made possible by aligning policy advocacy with private sector initiatives to ensure the technologies are affordable, like I just said, and accessible to rural and underserved communities. So ITO's effort highlight the importance of advocating for policies to support both local capacity building and private investment in genomics, and ensuring that advancement in healthcare are equitable and sustainable. I mean, all of that, overall, I've learned that policy advocacy in genetics and genomics is a critical driver for ensuring that potential benefits of these technologies are widely accessible across Africa. One more time, I would like to add one point. So based on my experience in clinical trial, coordinating clinical trial, I would like to address the potential economic, I would like to address the potential economic disparities created by access to genetics and genomics technology, because African countries can leverage clinical trial opportunities as an incentive for private sector involvement by incentivizing the private sector, the private companies like pharmaceutical companies, and investing in local clinical trials. Government can promote greater access to advanced medical technology while creating economic opportunities. Well, what I mean is the advantage is really positive for the local population. Most of the time, you find clinical trials being conducted not in a capital city, but in other cities, in other towns, in other communities. And this could work because it will create partnership with the private sector. So the government can create a framework that encourage collaborative work, collaborative a collaboration between private pharmaceutical companies, biotech firms, and local research institutions to conduct clinical trials in Africa. This could include offering tax breaks, grants, regulatory support for companies willing to set up clinical trials or contribute to genomic research, which is on at the moment, which is where a lot of focus is on, because we're talking about personalized medicine. We're talking about people receiving the product for according to who they are, according to what they have, the allergies and etc. So this could also bring development for local infrastructure, because in supporting the establishment of research facilities, laboratories, and skilled workforce training, governments can make it easier for private companies to run clinical trials in a region, in a specific region, or in an endemic region. This trial could focus on diseases disproportionately affecting African population, ensuring that the benefit of genetics and genomics technologies can tailor the healthcare, the health status of the local population, and also assessing to cutting edge treatment. This could bring access to cutting edge treatment in a way that clinical trials often provide participants with early access to promising treatment. By incentivizing private sector involvement in African clinical trial, government can ensure that this innovation reach local population, bringing the gap in access to cutting-edge health technologies that might otherwise be available only to a healthier population. So choosing a population for a project, a clinical project, a clinical trial, a medical research, can really, for example, for a project like malaria, for some reasons the population can receive free most ITN, so impregnated treatment net. You can receive for the pregnant women, they can receive free malaria preventive malaria treatment, and so chemotherapy, and they can also receive spray, things like that. So for me, at the end of the day, it's also bringing a local economic growth and a job creation, because when you are engaging, when you are setting up for a clinical trial, or you are also you're setting up a team with healthcare professionals. You also need drivers to take the healthcare professional to the remote areas. You also need an administration team, and etc. And it's also building local expertise and knowledge, improving the knowledge of the local population, giving them that information that they only probably see on TV, but also empowering them. It's also empowering the community. It's engaging with them and listening to them, listening to their past experience and what happened before, and how the pharmaceutical company can contribute to the local development of that community. So that's what I wanted to add, which I think is important for this course. Thank you very much, and thank you for taking my point across. Thank you. Bye.